Do you have an appointment? No? Well, do you at least have a referral for me? No? Well, then I'm sorry I can't treat you. Please try a different clinic elsewhere. I'm way too busy for this. Excuse me? Just because you don't see anyone else around doesn't mean I'm not busy. This is a private practice, after all. I choose who to treat. And right now, my schedule seems to be all filled up. You can see yourself out. Thank you. My. I do enjoy when they're desperate. You really need my help, don't you? Well, a good doctor like myself can't leave you hanging, now can I? But before I treat you, I guess you deserve to know what you're getting into. What can I say? I'm a good doctor. What I mean to say is, are you sure you want to be treated by someone whose nickname is the Plague? That didn't scare you off. I guess, can't be helped. But, another warning for you. How to put this delicately? What I sell here isn't exactly legal or FDA approved. It's medicine of my own making. Potent, I assure you. It can cure many ailments. But, thought you should know. Are you still wanting to be treated by me? Knowing all that, I mean, it's your health at risk. Are you trustworthy? Somehow I find that a little hard to believe. How old are you? You seem a little young. Likely story. How can I be sure that you're trusted? How about this? Why don't we strike up a little deal, you and I treat you for whatever ails you. But there's a catch. The catch is this. You become my guinea pig. How's that sound? What does that entail, you might ask? Well, you have to take part in my many drug trials. I'm always working on new formulas. Something, pretty spectacular, if I do say so myself. Oh, so that's how you found out about me. Those rumors are getting out of hand. But you never know. They might be true. And you know what they say. That doctor at that shady clinic, she can cook you up something powerful, superhuman, something that really helps whatever ails you. Is that what they say? And that's why you found me. Well, no accounting for taste. I am the best, after all. nickname notwithstanding. That's just, all in the past. Well, do we have a deal? A bargain? Let's shake on it. Guinea pig. Good. But a handshake's not gonna cut it. I'm gonna need you to fill out a few forms. Of course, the standard forms of new patient intake, but also some legality, some consent forms. Just to make sure you're not going to tattle on me. Wouldn't be really good for business, now would it? And I already have cops banging down my door every few days. So if you are into something shady as well, that's my warning for you. Still? Wow. I do love someone who's sure of themselves. And again, the desperation, it's divine. I really did need a new guinea pig, and one just fell right into my lap. Let me go get a few things and we'll get started with the paperwork now, shall we? After you sign, there's no takebacks. Be right back. You ready? Good. What would you like to start with first? Consent forms or patient intake? Of course. Let's get the nasty business out of the way first. The non-fun things. Alrighty. Do I have your consent to test new medication on you? Do you consent not to leak any information from what you hear, what you see in this clinic to the outside public? Do I have your consent to give you different medications that may harm or help you? I did say they were untested. My, still so brave. Do you promise not to ask what's in these medications? Do you have a next of kin? Just in case. Last name? And a phone number to contact them in case things get really nasty. Okay. 5, 6, 38. Last but not least, do you promise, do you swear, not to tell anyone what goes on in this clinic? And I do mean anything. They don't call me the plague for nothing. Again, just a silly nickname. Don't worry about it. I certainly won't. Good. Alrighty, you can just sign here, here, and here in triplicate. Here you are. Oh, did she need my pen? Of course. Go ahead and sign. Perfect. And is this your legal name? Well, that leads us into your next lovely set of documents. Your patient intake. Hmm. Don't worry, I'll file that away later. Okay, so name. Unusual name. Are you from the big city? I figured. And date of birth, if you please. I know I said you look young, but never hurts to be cautious. Okay. Interesting. Your address, if you would be so kind. Oh, don't tell me you're afraid. Trust me, I'm not going to be doing any unexpected visitations. I guess only if you ask nicely. It's not really in my repertoire. And a phone number. Oh yes, it's very important. I want to check up on my newest guinea pig from time to time. Make sure that there's no lasting side effects to anything I give you. Trust me, all in the name of science and health. Again, I am a doctor, after all. No, I'm being serious. Even though people like to call me a quack. Thank you. My, that was like pulling teeth. Okay, wonderful. Now for my next set of questions. Do you happen to know your blood type offhand? AB, A, O, O negative. Interesting. Do you have any medical history in terms of long-lasting ailments? Like asthma, heart murmurs, that sort of thing. Even high cholesterol. Okay. Anything else? Do you take any medications for any of these on a regular basis? Maybe not for long. You never know, we might find something that helps a bit better than those over-the-counter big pharma medications. Perfect. Now, tell me, do you suffer from any of the following? Migraines? Stomach aches? Dizziness? Do you suffer from blurry vision at times? Okay. What about acid reflux? My, do you just have a weak heart or something? I'm just teasing. You just suffer from common ailments. Most people do. By the way, how are your allergies this season? Do you suffer from any allergies, runny nose, any sinus pressure, ringing in your ears? No. Lucky you. The season has not been kind to me. Alrighty, now tell me about any allergies you might have. To any medications or any food, any, fabrics, irons, metals, any allergies you can think of. Okay. Anything else? Okay. And what about your diet? What's that Do you eat 1 meal a day, 2 meals a day, 3 meals a day? And do you follow the food pyramid, so to speak, pretty regularly, or? Okay. It's okay. I myself am a late night snacker too. And do you have any dietary restrictions? No? Okay. Wonderful. Okay. And last but not least, tell me how you sleep. Do you have insomnia? Can you fall asleep within a drop of a hat? Same. Takes me a while too. An unfortunate side effect of a busy mind. And how long would you say you sleep for on average? Do you get about 5 hours a night, 6 hours a night, 10 hours a night? Okay. Interesting. Perfect. Last but not least, I know that the last one was the last one, but this one isn't strictly on the books. Tell me, you don't happen to have a fear of needles, do you? Of shots? Didn't think so. But in case you do, trust me, I'll be, gentle isn't the right word, but I'll be kind. Because so far you've been quite cooperative. Very good. I do appreciate that in my test subjects. Well, let's get started. Let's take some baselines, and next time, or maybe even this time, if you're lucky, you'll get to take something, and we'll see whether or not it works out for you. Again, untested and all. I do have your consent, though. I have the paperwork for it. Well, why don't you get comfy on the bed, and I'll be right back. So tell me, what is the exact reason about why you need this medication so badly? Well, color me intrigued. Most of the time, people run away as soon as they find out that, well, my nickname, of course. You want to keep secrets. I guess I can understand that. But tell me, I'm quite curious. Oh, you need it for studying, for concentration. I guess I can understand that. Being a student and all, even a salary person, can be quite draining at times. Right, sounds kind of silly, asking your consent after all the paperwork I made you fill out. At this point, I feel like I know you better than your mom or dad knows you. But anyway, do I have your consent to get a bit closer? I just want to feel around your face, mainly your sinuses, feel around your eyes and your neck, just so I can get started. Perfect. Okay. Hold still for me. No sudden jerky movements, okay? I don't want to accidentally, poke an eye out or anything. That wouldn't be good for either of us. Why does that surprise you? I like my guinea pigs healthy. Just so I know that they can withstand what I give them. Okay. feel a little puffy, but tell me, were you eating something with a lot of salt recently? Makes sense, okay. Perfect, alright. Just gonna gently push out, feel around. I'm gonna come behind your ears and just kind of see. Feel if there's any tenderness, any swelling that I need to be concerned about before we begin. No? Okay. Would you, tilt your chin up for me? That's a good guinea pig. Perfect. I'm just gonna gently press along your neck. Okay, run my fingers along your jaw. Good, okay. This seems okay. Good, okay. Now, I'm gonna check within your ears first. I want to make sure that there's no swelling, no abnormalities. You can never be too concerned. You hear everything okay, right? We'll test that in a second. Let me get a quick look. Okay. This shouldn't hurt at all. Trust me, we'll get into that later. Lucky you. Alrighty. I'm just gonna gently come over here and try and see if I can take a look at what's in your ears. Interesting. I don't see anything that should be alarming. Okay, let me check the other one. Stay still for me. Okay, everything looks pretty good in this one. Maybe a little bit of wax built up, but that's okay. That's normal, that's normal. Okay, looks pretty good. Now let's move on to some quick ear tests, okay? Good. Alrighty, I'm just going to wiggle my hands and you just tell me if what you're hearing is from the right ear or the left ear, okay? Make sense? Okay, good. Alrighty, so what about here? Left to right? Good, okay, what about over here? Left to right? Good, okay, what about now? Both, good, okay, what about over here? Good. Good, alright, so I want you to tell me when you hear the sound closest and when you hear it the most far away, okay? Good, alright, so is this far? Too close, good, alright. Far, close, good. Far, okay, good, okay, what about here? Very close, okay. Very far, perfect, okay. Far or close? Far, okay. Very close, good, okay. Everything seems to be working okay. That's good. Next, let me just check your mouth, okay? I want to check your teeth health, your gums, your tongue, make sure everything is colored correctly. Also want to check the back of your throat. Make sure there's no swelling. Do you still have your tonsils? Okay, okay. Well, never hurts to check. Never know what my medication can do. Okay. And what I want from you is to say, ah. Can you do that for me? Ah. Alright, I'm just gonna quick check over here. Really open up wide. Okay, okay. I don't really see anything abnormal, no swelling. Good for you, but your tongue does look a little dry, so maybe keep up with water intake, okay? Just some friendly doctor advice. Alrighty, next, if I could just get a quick look at your eyes, okay? Just want to check the color. No, not the actual color of your eyes, more like the colors of the whites of your eyes. Okay, not that I see. It looks pretty good. Though I can't tell, you've been a little stressed. It's because of the redness. Maybe I'll give you something for that before you leave. Maybe some eye drops. Or not. You can take your over-the-counter stuff or whatever. It's fine. Would you mind if we did a really quick eye test? Okay. Do you, by any chance, know if you have a, good vision 20/20, nearsighted, farsighted? Okay. Do you wear contacts or glasses at all on a regular basis? No, not for fashion, for actual vision impairment. Okay. It's good to know. Again, I want to make sure that I know exactly what my medication does. Alrighty, let's start with something a little easy. Let's do the third line. Tell me what this first letter is. F, good. What about the next one? B, what about the next one? Good, okay. Let's make it a little bit harder. Can you look at this line for me? What's the first letter? E, good. What about this one? Third one in. D, good. What about the next one? Can you tell me what the next one is? C, good. Okay, looks pretty good. Wonderful. All right, can you read these numbers right here? I know they're really small. A little too hard for you? We'll just try. These right here. I think that's a 6. Okay, what about the next one? A 3 or an 8. Okay. What about the next one? Okay, you're sure that one's an 8. Okay. Oh, interesting. Alrighty, not too bad. Alrighty, I'm gonna quick take your temperature. Just want to get a baseline for that as well. Hold still. Okay. Interesting. You don't have to hold your breath for this part. You can just breathe normally. Okay. Perfect. That looks to be about average. Good. Okay, one last thing, if you wouldn't mind. Alrighty. I'm just going to plug something in. Just like that. Perfect. And I'm gonna wrap this around your arm. It's fine. Perfect. Alrighty. And I just want you to tell me whether or not you feel a little zing. Okay? Perfect. Alright. Feel anything? Okay. What about now? Good. Okay. And what about here? A little bit of a shock. Interesting. Okay, what about if I turn this knob? No. Okay. How about now? Okay. A little bit. Good. How about this one? Good. Okay. And what about a big jolt? Okay. Alright, I'll turn it off. Let me just unplug that. Don't worry, I won't forget. I'm gonna unwrap this from your arm real quick. Again, quite surprised. I have a really good guinea pig so far. Now, I'm gonna quick listen to your heart, okay? This time I'm gonna ask you to breathe in different intervals, okay? Alright. You ready? Good. Breathe in. Breathe out. Okay, again. Breathe in. Breathe out. Good, okay. Let's move to the other side. Breathe in. Breathe out. One more time. Breathe in. Breathe out. It's a little fast. Is that because I make you nervous? I get that a lot. Oh, don't worry, I'm not going to take it personally. I like having that effect on people. Keeps them on their toes. Alrighty. Now, the last thing I need from you, little guinea pig, is to take a bit of a blood sample. Remember, you have to do what I say. I do have that in writing. And I did ask whether or not you have a fear of needles. So it's okay, but in case you get lightheaded or a little dizzy, which I know you're prone to do, you're more than welcome to just relax here, okay? Okay? Good. Just gonna clean the area first. It's a bit of a strong scent, but it's okay. Okay, now which arm? Left, right. That one. Okay. Just gonna gently swipe. You ready? Again, it's just gonna be a tiny little itty bitty pinch. Okay? Nothing you'd be scared about. Okay. You ready? Again, just gonna be nice and quick. Just a little bit. Pinch. I don't need a whole bunch. Count to 10 for me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 9.5, and 10. Perfect. I think that's a good sample. Are you okay? Not feeling too lightheaded or anything? Still okay to continue? Good. Now tell me, little guinea pig, are you feeling brave enough to try your first dose of unlicensed and untested medication? If you do this, remember, I will treat you for any of your ordinary ailments. Free of charge. Good. Again, I do like the fact that you reek of desperation. Okay, now, expect you to take all of this down in one go. Here you go. It's not poisoned. Well, maybe. Well, I definitely know there's nothing you're, allergic to. Yep, all in one go. How's it taste? How are you feeling? Does it taste a bit bitter? Does it taste a bit sour? Is your vision getting blurry? And there they go. Not the exact side effects I was looking for, but I can't send them out now that they've passed out. Well, I guess they can stay here. Hmm. How am I to get them back onto the bed? Well, hopefully they don't mind a few, scrapes and bruises. And you never know. Once they're up, maybe I can test a second one on them too. Things are looking up for me. What a nice little guinea pig you'll make. Alrighty now, up you get. I'm just gonna